We now come to the backbench debate on mental health support in educational settings. Chris Bloore to move.
Thank you, Madam Deputy Speaker. I beg to move that this House has considered mental health support in educational settings. I want to thank the Backbench Business Committee for granting this debate and the MPs from across the House who supported its application. I would also like to thank Emily Horsfall, my team and the staff of the Mental Health Foundation for their support in preparing for today's debate. There should be no doubt that good mental health and well-being are as critical to the progression of our young people as physical health. Protecting mental health at an early age can have a defining impact on lifelong resilience and ensuring positive mental health outcomes. At a time when our young people face a barrage of challenges from social media, especially girls and young women, from what feels like a never-ending conveyor belt of demeaning and misogynistic content, the consequences of the COVID-19 pandemic and the cost of living crisis impacting young people up and down the country, to me this is a timely debate, and I thank those honourable members who have stayed in the chamber to contribute today. Much of what I will say today reflects my conversations with young people, parents, teachers and professionals in my constituency of Redditch and the villages, all of whom, when they approached me either on a visit in Tesco food shopping or at one of my surgeries, displayed a level of courage and determination to build a system fit for purpose that will ensure all children get the support they need to have the most fulfilling lives possible. I hope this debate can be about how we can support our schools, particularly our education professionals, who are not trained mental health professionals, but are so often on the front line to ensure our children get the best support they can at the most appropriate time. Of course.
Can I commend the Honourable for Redditch for bringing this forward? And I was just looking at some of the stats for Northern Ireland to support in what the Honourable Gentleman is trying to achieve. In 2023, in Northern Ireland, pupils with disabilities reported lower levels of general well-being across all measures as compared to those who are non-disabled in schools. Does the Honourable Member agree that access to pastoral care teams who are equipped and trained to deal and help those with declining mental health due to disabilities in schools would be one of the ways of addressing this very issue?
I thank the Honourable Member. I think that's my first intervention from him, so I feel very honoured for that. But I absolutely do agree with him, and I will be talking about other groups as affected, as he has mentioned later on in my remarks. So I thank him for his intervention. I hope this debate can be about how we can support our schools, particularly our education professionals, but I also hope that this is a discussion that brings awareness to the challenges faced by young people. I know some like to hand-wave away any discussion about mental health problems among children and young people. Since the publication of this debate and from reading previous debates elsewhere, a few people have whispered in my ear that they don't believe children are resilient enough these days. Well, I simply don't buy that argument. I know it makes some uncomfortable when young people talk about their mental health challenges, but to me it can only be a positive thing that awareness and mainstreaming of mental health conditions have given confidence to so many across society to have honest conversations about how they're feeling and the impact of others' actions can have on their mental health. So what do the statistics tell us about the state of our young people's mental health? NHS statistics show us that in 2023, about 1 in 5 children and young people aged 8 to 25 had a probable mental disorder, and urgent referrals of children and young people to emergency mental health services have tripled since 2019. The uncomfortable truth is that waiting lists for children and adolescent mental health services can be a postcode lottery. For instance, in November of last year, the average waiting time for a child for a referral to a first appointment in Hereford and Worcestershire was 7 weeks, compared to the national average of 5 weeks. We also know from Freedom of Information requests that one child waited almost 2 years for an appointment. Referrals at Hereford and Worcestershire Trust have increased by 118% in the last 5 years, a trend that is reflected across the country.
Will my honourable friend give way on that point?
Of course.
I thank the honourable friend for securing this backbench debate. That statistic of 1 in 5 young people with a mental health condition, must concern us all. I hear from my own constituents in Shipley constituency that they are waiting a long time to get their children seen on the NHS, whether that's for an ADHD assessment or trying to get medication. And during that time, the children are unable to participate in school. So does my honourable friend agree with me that it's vital that we get children and young people's access to mental health, get those waiting times down so they can participate properly in school?
I thank the honourable member for intervention, and I absolutely agree. It's about parity between mental and physical health. we would move heaven and earth if those children had physical injuries, and we must do more to assess and treat those mental health conditions that young people are suffering from. Of course.
Crispin.
I thank my honourable friend for giving way. He makes a really valid point about the need for parity between mental health and physical health. Would he also agree with me that actually there's a connection between the two, and quite often poor physical health can impact your mental health, not your mental health, the mental health of that young person, and vice versa?
I thank the honourable member for his intervention and agree entirely, and many of the young people that I've spoken to have suffered from long-term physical conditions or illnesses that have had a detrimental impact on their mental health. There's evidence that the severity of mental distress has increased too. Admissions to acute medical wards for mental health concerns in children and young people increased by 65% between 2012 and 2022. The Association of Colleges Mental Health report published in September found that 90% of respondents reported an increase in disclosure of mental health issues for 16 to 18-year-olds and 86% for those over 19. Most colleges are increasing their mental health resources, but the need for joined-up and well-resourced services is urgent. The report found that almost a third of colleges reported at least one death by suicide in the previous year. It's distressing to consider, but this escalation can and does happen, and this is why this debate is so important today. Despite the expansion of children and young people's mental health services, the increased demand means that NHS estimates that less than half of those with needs are being supported. The Children and Young People's Mental Health Coalition found that certain groups have an increased likelihood of being impacted by mental health challenges. Children and young people with special education needs and disabilities, those from racialised and LGBTQ+ backgrounds, neurodivergent young people, those with physical or long-term conditions, young carers, children in care and refugee and migrant children. Children in kinship care arrangements also have a high prevalence of social and emotional and mental health needs similar to that of looked after children, but owing to their lesser entitlements and access to suitable support, their experience and needs should be considered when designing vital mental health support in education settings. The complexity of issues that may impact a child's mental health is why mental health charities have been campaigning for a cross-government mental health approach for such a long time, and I hope this government can deliver on this. But why are education establishments so crucial as part of this debate? The Centre for Mental Health has published research that 75% of lifetime mental health difficulties occur before the age of 24, and 50% occur before the age of 14. That is why education settings are critical in addressing this national crisis. Of course, schools and colleges are seen as places where children learn academic skills, but they also are safe places for some to seek support. Currently, mental health provision in education settings in England is varied. Mental health support teams can be found in almost 50% of schools, and they've proven highly effective. Research published by Bernardo's has demonstrated that for each pound invested, the government has saved £1.90. The education and health officials I have spoken with have said we must reach England-wide coverage of MHSTs as soon as possible. If this was done in combination with the government's promise of delivering a school counsellor in every school, that would be a powerful indicator of this government's commitment to tackling this crisis. I'm not sure.
Danny Chambers.
Giving way on this hugely important subject, 'cause I'm sure like other people across the House, children's mental health is one of the subjects that comes up most frequently on the doorstep of parents really struggling to get the mental health care that their children need. One of the questions that is asked most frequently is how can we afford to increase mental health care? Will the honourable member agree with me that it is actually more cost effective to provide timely mental health support than it is to end up treating people when they have been sicker for longer?
Chris Bloore.
I thank the honourable member for his intervention. I would argue we cannot afford to take early prevention and intervention on these issues, and it does save the government money further down the line. I take the intervention from my colleague.
You will know that, the honourable member will know that suicide is the main cause of death for young people under the age of 35 in the UK. And for those under 18, school is where our young people spend the majority of their lives and where we have an opportunity to make change. Will my honourable friend join me in paying tribute to the three dads walking who have played a significant role in ensuring that this issue stays on the agenda and to tackle the assumption that talking about suicide makes it more likely to happen?
Chris Bloore.
I thank the honourable member for that important contribution to this debate, and I do pay tribute to the group mentioned. It's such a critical issue and it's such an important issue to the future of our young people, and I congratulate anyone that comes into this space and makes a positive difference to the outcome, so I thank her for that intervention. Despite the best efforts of many teachers, education settings have yet to have much of this dedicated support. The experience of some young people themselves and their families show that the support on offer in some schools is not quite sufficient. The Mental Health Foundation works with whole families to support them in developing their mental health together. Ahead of this debate, they asked 2 of their participants in one of their programmes in London, Bemi and her daughter Ayo, to share their own experiences. Bemi said that they say the government are going to invest in children's mental health, but this isn't happening. There is a lot of pressure on children these days. It is having a toll on children's mental health, and as a parent, I am also feeling the strain of seeing the constant breakdowns and the failure to access support. Her 13-year-old daughter, Ayo, suggested that schools need to be much more proactive in asking about children's mental health. She said no one is asking how we feel and never attempting to get to the root cause of things. They only pick up when we are behaving irrationally, but never try to figure out why they feel this way. Now, school staff are often the first point of contact when a pupil struggles with their mental health, so they need to feel confident that they have the support for pupils and can spot the signs of early difficulties. Education Support, a charity supporting the mental health and well-being of teachers and education staff, found that 74% of staff often help pupils with personal matters beyond their academic work. Educators are filling in where there are gaps, further highlighting the need for joined-up and embedded services.
On that point?
Of course.
Thank the Honourable Gentleman for giving way. I totally agree with him that schools and teachers are at the forefront of this mental health crisis that's facing our children. I recently visited a local primary school, Pavilion Woodhead Church of England Primary, and I'd like to pay tribute to the staff there for the excellent work they're doing to support their young people with their mental health and making it much easier for them to talk about it. But would my honourable friend agree with me that it's vital that schools have the adequate resources to provide that sort of support?
Chris Bloore.
I thank the Honourable Member for her intervention, and I absolutely agree. Because it's not just young people who are struggling as part of this process. The additional workload of carrying out wellbeing checks, sometimes in distressing situations, is taking its toll on staff. 78% of all staff are stressed in education settings, rising to 84% amongst senior leaders. No one can do their best at work if they are mentally depleted, and healthy teachers can provide better high-quality support for their pupils. But what else can we do? We can't ignore the other factors significantly impacting a young person's well-being, which is why we need a whole government approach. Children and young people might be experiencing poor quality housing, overcrowding, family members in low-paid and insecure work, or the inability to get a GP or NHS dentist appointment when they need it. All challenges that I'm glad that this government is taking action to remedy. But we can go further. The Mentally Healthier Nation report, unanimously endorsed by mental health charities, calls for the rollout of anti-bullying programmes across the country. Crucially, the evidence shows that these programmes work best when delivered in a whole school way. That is, rather than just taking a narrow approach based on discipline, the student and staff body understands what constitutes bullying and its impacts, stands against it, and has tactics to prevent it. These programmes have been tested and shown to be effective. They create healthier school environments, prevent mental health problems in the future, and lead to economic gains. The costs of picking up the pieces of childhood bullying in later life are enormous, as are the losses to the labour market it can cause, as well as the toll of bullying in the here and now. Young people can use the text service called Shout, a crisis line for help when they are being bullied, and they report texters struggling with suicidal thoughts, urges to self-harm, insomnia, and feelings of depression and anxiety. Some refer to the anger, shame, fear, confusion and vulnerability, hopelessness and frustration that resulted from being bullied. Others spoke about their lack of focus and poor performance at school as a result of their bullying. But we also need to look at innovative new ways developed to address the threats our young people are experiencing. In a world where so-called influencers like Andrew Tate can get their claws into our young men's minds, we need to look to the work of people like the Mental Health Foundation's Becoming a Man programme. Currently operating in Lambeth and Islington, it works with young men aged 12 to 16 who face disadvantage and inequality that put them at greater risk of developing mental health problems. It creates a safe space for young men to come together and discuss issues about their lives, taking into account their lived experiences and often difficult environments they navigate. It helps to develop strengths like integrity, self-determination, positive anger expression and respect for women. Early evaluations of this work are promising and government support is needed to grow the evidence base. Schools have a vital role in understanding young people's online experiences and how it might impact their mental health. The Girl Guide's Girl Attitude report that 1 in 8 young people aged 13 to 18 had seen sexual threats directed at women and girls online, including those of rape. 1 in 8 girls said they had received sexual threats online from strangers or someone that they knew. Over a year after the passing of the Online Safety Act, suicide, eating disorder, race hate and incel forums remain easily accessible, and it's not clear if and when action might be taken against them. Given Ofcom's permissive approach, it's likely that school staff will need to understand what sorts of communities the pupils are involved in and the impact that it's having on them. At a time when 36% of boys said they have had Andrew Tate content shown to them by a friend in school, the onslaught against young girls' self-confidence, value and worth goes further than being content on a screen. It's putting them at risk. So how do we pull all of this together? When it comes to preventative mental health, perhaps overwhelmed by the complexity of the challenge, we find initiatives scattered, rarely appropriately funded, and often don't learn from each other. Sometimes we even use localism as an excuse to neither fund systems or hold them accountable. We must create a public health mental infrastructure. The Mental Health Foundation describes this as having a clear roadmap led by evidence in which every part of the system will know its responsibility for reducing mental health problems and will be funded for and both held accountable on its delivery. That means re-examining the public health grant, which despite a welcome uplift this year, is still well below 2015 levels. It means ring-fence funding for schools and the NHS tied to specific outcomes. It also means the rollout of England-wide mental health support teams and counsellors in each school. The Children and Young People's Mental Health Coalition responded to the NHS 10-year plan consultation, calling on the plan to financially support integrated care systems to deliver a comprehensive roadmap for mental health for 0 to 25-year-olds. The AOC found that more than 30% of colleges are not involved with their local suicide prevention plan, and 65% stated they do not have a joint provision with their local NHS trust. It's clear that to keep children well and safe, our NHS services and their commissioning bodies must be fully integrated into mental health support in educational settings. Schools, colleges and universities should be included in their local mental health strategies, and data should be shared freely. I'm excited by this government's pledge to roll out Young Future Hubs, which aim to bring local services together, deliver support for teenagers at risk of being drawn into crime or facing mental health challenges, and where appropriate, deliver universal youth provision. These initiatives could represent the start of an infrastructure and an implementation plan for a national network of these hubs. The Royal College of Psychiatrists say that these hubs have the potential to support some of the most minoritised children who might not be able to access CAMHS or school-based services consistently. I am pleased to see that the NHS remains committed to expanding access to children and young people's mental health services, and the operational planning guidance recognises that early intervention improves outcomes for children throughout their lives, reduces long-term pressure on health services, and benefits the economy and wider society. I urge the government to seize this moment and see if it can create a true network of mental health support across this country, getting those anti-bully programmes in place, following the evidence and committing to relentlessly drive down levels of poor mental health and build mentally healthy communities in schools and beyond. Prevention, early help and treatment can help these young people deliver positive outcomes. Yes, many of the measures I've referenced today and the ones already announced by the government will require significant investment. However, the cost of inaction and the knock-on impacts on education and children's social care will far outweigh any initial outlay. Now is the time for action. Thank you.
I think we have 8 members hoping to contribute. We'll calibrate again, which means there will be a time limit of 4 minutes because I want to make sure we all get in. And the first contribution is Sean Berry.
Thank you very much, Madam Deputy Speaker, and thank you so much to the Honourable Member for Redditch for bringing this debate, for talking about the importance of these programmes, for talking about anti-bullying programmes as well, and for the members who've brought in the wider mental health crisis and the extent to which teachers are picking up the pieces. All these are really vital issues to talk about. Now, I'm proud to say there has been some groundbreaking work in mental health support in educational settings in my own constituency of Brighton Pavilion. A campaign led by young people and backed by Citizens UK secured funding for counselling capacity in local schools, and it is a genuine cause of citywide pride. The £200,000 of investment for Brighton and Hove City Council will support hundreds of young people with counselling across the city, including many in my constituency. And I was very, very inspired by the work of the students pressing the councils for this, notably Fee Abu-Chanad and Tally Wilcox, who put their case directly to the council. I talked to them about them in my maiden speech in this house. And I'm very grateful to Brighton and Hove City Council, which did back up its words with funds to support this vital work. I'm pleased to see that following the pilot, there will now be another year funded for 2025 to 26 by the council. The key request now from the British Association for Counsellors and Psychotherapists and Citizens UK is for government-funded school counselling provision delivered by specialist children and young people counsellors and psychotherapists on a statutory basis. So I welcome the pledges from the government to introduce a mental health professional accessible in every school, and I hope we'll see real investment in a national school counselling programme promised by ministers today. To conclude, thank you to the Honourable Member for securing this debate. I would once again like to pay tribute to the courage and campaigning of the young people I know who are out there all around the country demanding support in all our constituencies. Nothing could be better value or more important than investing in the thriving of the mental health of our young people, and particularly within schools.
Thank you so much for keeping well within the time limit. I call the Education Select Committee Chair, Helen Hayes.
Thank you, Madam Deputy Speaker, and I congratulate my honourable friend, the member for Redditch, on securing this important debate and on his excellent speech. The starting point for thinking about mental health services in education settings must be an understanding of the foundational nature of good mental health and well-being for everything we seek to do in life. Challenges with mental health are corrosive for every aspect of our lives. Depression or anxiety can ruin the happiest of celebrations on the sunniest of days. It can prevent us from focusing on essential tasks, can affect our relationships with friends, family members and colleagues, and can leave some people feeling unable even to get out of bed in the morning. That is true for all of us as adults, and it is equally true for children and young people. Good mental health and well-being is essential for accessing education and for getting the most out of it. Yet our children and young people are suffering an epidemic of poor mental health and well-being, and it is holding them back. In every school that all of us as members of this House visit in our constituencies, I'm sure we will have heard head teachers, senior leaders and teachers in our classrooms talking about the challenges that the young people in their classes face with their mental health. And that's borne out by the data too. In 2023, 1 in 5 children aged 8 to 16 had a probable mental health disorder such as depression or anxiety. And among young people aged 17 to 19, the rates of probable mental health disorder have increased over just 5 years, from a tenth in 2017 to more than a quarter by 2022. So, Madam Deputy Speaker, in this context, I welcome the Government's commitment to place a mental health professional in every school across the country. But there are some additional points that I wish to raise which are relevant to the effectiveness of that rollout. The first is around clarity, which I hope the Minister can give, on the level of qualification that mental health professional will be required to have in every school. And the second is whether their remit will be, as well as delivering services to young people, to drive a culture across the whole school that is conducive to good mental health and well-being, which will, as he will know, involve the buy-in of the most senior leaders in those schools. And there are other areas outside of school which are relevant to children's mental health and well-being. The crisis in our special needs and special educational needs and disability system is having a profound impact on children's mental health and well-being. And my committee heard this week from children who had been hospitalised and diagnosed with post-traumatic stress disorder, not as a consequence of their additional needs, but as a consequence of being in schools that are unable to meet their needs. And I know that the Minister knows about the urgent need for reform of our SEND system. Mental health professionals in schools will also quickly be overwhelmed if we cannot get to grips with the crisis affecting our children and young people as a consequence of their addiction to smartphones and their access to social media, which we know is making our children more anxious, less able to focus, more sleep deprived and more stressed out. And I welcome the measures the Minister announced in response to my honourable friend's bill on Friday, but I do believe there is a need to go further with this urgent crisis which is affecting the mental health and well-being of our children. Finally, Madam Deputy Speaker, I want to touch on the vital issue of CAMS waiting times.
We have GPs to prescribe antibiotics so that infections don't become sepsis or blood pressure medication to prevent a heart attack or stroke. But when an infection has become a critical illness or a patient has suffered a heart attack or stroke, we wouldn't think for 1 second that it was appropriate to send them back to their GP. Yet that is exactly what happens to far too many children and young people who are seriously mentally unwell. It is an unacceptable situation, and as well as looking at mental health and wellbeing support in education settings, we also need to look at how our NHS can deliver much more quickly and effectively for children whose problems are much more serious than that.
John Milne.
Thank you, Madam Deputy Speaker, and thank you, Honourable Member for Redditch, for bringing this important debate. It's time to acknowledge that SEN and mental health provision in schools is one of the great crises we're facing today, although I do appreciate there's a lot of competition for that particular accolade. Financial pressures have significantly impacted CAMS funding in my constituency of Horsham. Despite a modest 0.6 fee uplift for Sussex, the sector has faced a mandated 15% funding reduction, approximately 1.6 million, and that is coupled with rising staff costs due to higher national insurance contributions and an increase in the national living wage. Meanwhile, demand just keeps on going up. Since September 2020, Sussex CAMS has experienced a substantial rise in referrals attributed to the pandemic and the easing of lockdown restrictions. This surge has adversely affected waiting times for initial assessments and treatment. But the crisis is even sharper at the local education authority funding level. My local authority, West Sussex, has a dedicated schools grant deficit scheduled to go past 130 million by this April. They're allowed to keep this off balance sheet for another year, but there's only so long that we can maintain the fantasy that this service can be afforded without major central government intervention. But most of all, the pain is being felt at the school level and by the children and families who experience the many failings and gaps in service. I have been contacted by no less than 5 schools in the last fortnight alone regarding this issue. Typical of their message is this from Holbrook Primary School Governing Board. I quote, "Schools, trusts and local authorities are overwhelmed by the rising number of pupils who are seeking additional support and the ever-increasing costs of providing assistance. Urgent action is required now to help solve the crisis in SEND so the future of our children is not blighted by a system that is not fit for purpose." And I have to say, having visited many schools recently, the one thing I feel is it's verging on desperation of the teachers, but also their love for the children that they are looking after. They really desperately want to help them, but they are in an impossible situation, and there is, I'm afraid to say, an element of physical danger in some cases. It's not the children's fault, it's our fault. Horsham schools are asking for health services to take on more of the strain because they're at breaking point. But while mental health provision in schools has clear benefits, we must ensure that this provision doesn't fall on school budgets. Mental health support teams cover about 44% of schools in the UK and come from NHS budgets, not school budgets. That should become 100% coverage. The pressure on schools to cope with more and more SEN children with little or no extra funding is set to undo every gain we've made in educational standards over the last decades. I appreciate that the government is taking at least some action to assist things now, but the pressure, I would urge them to use every lever that they have to avert this crisis before it spins entirely out of control. Thank you.
Sojan Joseph.
Thank you, Madam Deputy Speaker. I congratulate my honourable friend, the member of Redditch, on securing this debate, and I am grateful to the Backbench Business Committee for finding time for it. I know from my experience that we have a mental health system that is overstretched and under-resourced. In fact, there has never been so much demand for mental health support for children and young people. In June, the number of active CAMS referrals in England was a record 840,000. It is clear that this government inherited a crisis in children and young people's mental health. We all want young people to be happy, healthy and safe, and to be equipped with everything they need to achieve and thrive as adults. but with half of mental health issues developing by the time that young people reach the age of 14 and 3/4 before the age of 24. It is essential that there is early intervention in mental health support for children and young people. Madam Deputy Speaker, happy to give away.
Thank you to my honourable friend for giving way. Last year I met the parents of a young woman struggling with their mental health in my constituency. She wasn't in crisis, but she did need some additional support. Her school encouraged her parents to withdraw her from the school because they couldn't provide the support, which they did because they didn't know what to do, leaving her now out of education for over 18 months and severely in crisis. Does my honourable friend agree with me that early intervention in schools is crucial for breaking down barriers?
Thank you, the Honourable Member, for the intervention. I agree with that, and I have many experience of similar cases. Madam Deputy Speaker, I want to illustrate this by referring to some real-life examples. In the Upper Waiting Hall this week is an excellent exhibition about the Mental Health Act that has been brought together by Mind. It features artwork and written pieces by people who have been detained under the current Act. I had the pleasure of meeting some of them on Monday, including a young lady called Afifa. Afifa is now 19, but was first detained under the Act when she was 14. She spoke powerfully and movingly about the treatment she endured while she was under section. When I asked her if there was one thing that could have helped her, she said without hesitation that if she had received mental health support at an earlier stage, she is clear that her experience would have been very different. The other examples I would refer to are from my own experience of working in mental health system and demonstrate the different early intervention and support can make. There are two young people who are of similar age. One is a teenage boy who unfortunately has not been able to access the support he needs, and as a result he is struggling to cope. This is not only impacting on his mental health, but is having a detrimental impact on his family, especially his parents. By contrast, in the second case, the parents of teenage girl who had been diagnosed with a mental health condition knew I worked in mental health at the time and so came to see me. I was able to ensure she was referred to camps at an early stage, and as a result, both she and her parents are doing well, and the young lady is due to sit her A-levels in the summer. This underlines how children who receive support quickly are less likely to develop long-term conditions that negatively affect their education, social development and health later in life. I welcome that Right Honourable Friend, the Secretary of State of Education, has been clear that children's well-being will be priority for this government. Research from British Association for Counselling and Psychotherapy indicates that children whose mental health difficulties are initially too complex for lower intensity interventions but are too complex enough to be referred to higher intensity interventions, such as camps, can easily miss out on the mental health support they need. Ensuring there is enough mental health support for children and young people in educational settings will help to free up NHS time and resources, while also making sure we have a healthy and productive population in the future. But we should also make sure that support exists in the community. So can I ask my honourable friend for an update on the government's plans for young future hubs? Does he agree that these open access drop-in hubs could provide an important step in providing community-based mental health support for children and young people? There is clear evidence that the places and circumstances in which people are born, grow, study, live and work have powerful influence on their mental health. As Place to Be have said, children and young people from low-income families are 4 times more likely to experience mental health problems than children from higher-income families. While 1 in 4 of the children and young people with diagnosable mental health condition live in a household that has experienced a reduction in household income. This is why I want to see reform of the way that we deal with mental health. From Westminster, I would like to see greater cross-government working to address the social detriments of our mental health. At local level, I believe that through greater cooperation between schools, colleges and universities with local health providers and others in the local community can help create education settings that are effective at protecting young people's mental health and general well-being. Taking this long-term approach will help create a society that prevents mental ill health for children and young people in the first place.
Thank you. Due to the number of withdrawals, we're now, you may have noticed, please be seated, you may have noticed that we've stopped the clocks. Basically, there are 2 colleagues left. I'm going to allow you to police yourselves. The ministers or the front bench want to be up by 4:30. So I'm going to let you manage this time between yourselves, and I call Dan Aldridge next.
Thank you, Madam Deputy Speaker. I've just gone through and scratched quite a lot out, but I will. But you'll probably be pleased about that. I'd like to pay tribute to my honourable friend, the member for Redditch, for his efforts to secure this important debate. Being an MP is a difficult job to define. It is true that there are 650 ways to be an MP, and we're all finding our way, but in choosing such a subject for his debate, he shows his humanity and the man that he is. So I really commend him for that. With debates like this, we can do good in this place. We have a profound opportunity to profile issues we and our constituents care about and fundamentally amplify the voices of those in our constituencies who might not otherwise get the attention they deserve. We can show them that they matter, restore their trust and faith bit by bit. I love this job because we get to do that. It's an honour to speak in today's debate on a topic that is critically important to the future of our young people. Mental health in education settings is an issue that affects the entire country and one that demands urgent action. 1 in 8 children and young people in the UK are living with a mental health condition, often left without the support, guidance and critically treatment they need to build resilience to thrive in our fast-changing world. For years, governments failed our young people by not providing the certainty and fundamentally the early interventions needed to support our children into mental wellness and the knowledge that when things go wrong, there is a safety net for them. This issue has only worsened since the pandemic, which amplified the strain on the mental health of young people, and too many students, and I see this, well, we will all see this across our families, are still not receiving the support they need. This is a crisis we cannot afford to ignore. Too many young people are not in education, employment or training because they've been failed by a system so woefully unsupported during a time when anyone who has any children or who works with them knows that this is a crisis and has been for a long time. Funding for mental health support teams represents a step forward in ensuring that young people receive the help they need, particularly at an early stage. However, we cannot overlook that much more still needs to be done to ensure that children in towns like Weston-super-Mare, Wirral and beyond do not fall through the cracks anymore. I welcome the government's progress in a short time, yet the reality is that not all schools are currently able to access these services. And even when MHSTs are available, the support is often not enough. I know everybody across this House is impatient for these much-needed improvements. As constituency MPs, we see the pain of the previous government's failure on child mental health at surgery after surgery. We must ensure that these teams are expanded across the country, reaching every school and every student who needs help. I'd like to pay tribute to all the teachers, support staff, volunteers and families across Weston, Wirral and the villages for their crucial role in supporting the mental health of our young people. These are the ones who see students day in and day out and who are the first ones to notice when something is wrong. Yet many teachers and teaching staff feel underprepared to deal with the mental health challenges in their classrooms. Staff should not feel they are managing these challenges on their own, and it is vital that schools are supported with resource but also ongoing professional development to help deal with the increasing prevalence of mental health challenges faced by their students. We must also recognise that the mental health of teaching staff themselves is just as important. Teaching staff work under incredible pressure, and the emotional and psychological toll of supporting students, often with their own challenges, can be overwhelming. If we expect teaching staff to support the mental health of students, we must ensure they receive appropriate support too. You cannot pour from an empty cup. The evidence is clear. Investing in mental health support in schools not only helps students emotionally and physically, but also boosts academic outcomes and overall school well-being. It cascades out to families and well beyond the school gates. We cannot and must not fail more children and families by not taking this seriously. The young people of Weston-super-Mare, like those across the UK, are bursting with potential, but without the right support for their mental health to navigate the challenges and take advantage of the opportunities of our fast-changing society. And I think that's important. We often talk it down rather than talk up, the nature of our fast-changing society. That potential won't be realised unless we equip them with those tools. I look forward to the government's continued expansion of mental health support in schools, and I urge them to ensure that our teaching staff are given the tools and support they need to look after their own mental health so they can continue to be the positive role models and carers that our students need. We trust them to look after our children every day, and we owe it to them to make sure they are looked after too. Thank you.
Amanda Hack.
Thank you, Madam Deputy Speaker. I first want to say how incredible it is that members are stood here in the Houses of Parliament discussing mental health for our young people. And I thank my honourable friend for Redditch for bringing forward such a critical debate. In a previous role on the Health Scrutiny Committee for Leicester, Leicestershire and Rutland, what was clear is that young people are waiting too long for treatment, and that is having a long-term detrimental impact on them. This is in addition to the increasing number of young people that are needing to wait on CAM's waiting list that are just too long. This is actually, we also need to look at those specialist services, such as those suffering with disordered eating. That has increased by double in just a couple of years. What is clear is we need to improve early intervention for our young people. We have to ensure mental health is discussed not only as part of the curriculum, but it's discussed with young people across their peers. And we need to ensure that young people reach out for support when they need it. And just as importantly, we need to listen to them and act when they do. Quite often young people are ignored. Our current children and young adults have experienced a global pandemic. We can't ignore this period in their lives and this impact that has had on some of them. I've got 2 teenagers, so I've seen it firsthand myself. By increasing mental health support in educational settings, we know we can provide the foundations that our young people will need for their future. We're discussing something that can't always be seen on the surface and often viewed as off limits. I often think about a group of young people that I visited in an alternative educational provision in Munira in my constituency. Just by speaking to them, I know how difficult and tough life has been already for them at such a young age. But I also feel very empowered from them. They were just amazing young people, and they knew that the support that they'd received when they needed it had turned their lives around. For some, though, school can be 6 hours of relentless bullying, abuse or loneliness. 60% of our 11 to 16-year-olds told Girl Guiding they received negative comments from other people about their appearance. Some of that will be within a school setting. And nearly half of 7 to 10-year-olds say they feel alone some or all of the time. 7 to 10, there's so little. Too often when conversations around mental health support is being had, we just talk about teenagers. Really, mental health support needs to be available for all young people of every age to help build healthy habits, help them talk about what they need from us, and set out where people can go for support. Of course, I will give way.
Thank you for giving way. I think that is a really salient point, actually. Before I became an MP, I worked with young people in youth work, and actually increasingly over the last few years, mental health issues that we saw normally on teenagers were becoming younger and younger and younger. Some of the links to that were, in my opinion, linked to younger and younger people having access to social media and not having maybe the breaks that we would have had as younger people. So I think your point is the honourable member's point is a very valid one. And would you tell me more about that?
Amanda, I thank my honourable friend for that intervention. Absolutely, I think that's the sadness is we always talk about teenagers, but if we can give those young people as young as 7 to 10 that resilience, actually we might be able to prevent them being poorly when they get a little bit older. We do have to start those conversations as early as possible to build resilience and confidence in our young people. And putting mental health support in educational settings will not only mean we can change the culture of schools for children who are struggling with their mental health. In addition, we will be up to see how young people can be supported in the right place, at the right time, in the right setting.
Oh. John Milne, point of order.
Thank you. In my speech earlier, I referred to West Sussex County Council and neglected to mention in my declaration of interest that I am currently still a member of West Sussex County Council. I'd like to put that on the record. My apologies.
Thank you so
which I thank the Honourable Member for his point of order. Now that he's put it on the record, it will be recorded as such. Thank you so much. We now come to the front bench contributions, and I come to the Liberal Democrat spokesperson, Munira Wilson.
Thank you very much, Madam Deputy Speaker. And could I start by congratulating the Honourable Member for Redditch for securing this incredibly important debate. I spent much of the past 5 and a bit years in this place talking about children's mental health, and I don't think, frankly, we can have enough debates about it because it's so incredibly important. We've heard many statistics from honourable members today, and I'm going to add to those. Evidence from the OECD says that UK students have the lowest reported well-being in Western Europe based on a survey of 15-year-olds. In 2024, the Children's Society found that the happiness of UK children aged 10 to 15 was at its lowest since recording began in 2009-10. And as we've heard with the NHS reporting that a staggering 1 in 5 children, that's on average 6 in every classroom, having a mental health disorder, Madam Deputy Speaker, I would argue that it is not an exaggeration to say that we are heading towards a public health emergency as far as our children's mental health is concerned. Yet, as is so often the case with both children and with mental health, they are often overlooked and low down the priority list. The Darcy report highlighted that children account for 24% of the population, but only 11% of NHS expenditure. And the latest evidence from Rethink Mental Illness says you're 8 times more likely to have to wait over 18 months if you need mental health treatment compared to physical health. Yet despite this, the government's targets on bringing down NHS waiting list times excludes mental health. And with over 100,000 children waiting over a year to be assessed for mental health treatment, it's clear that children have been deprioritised. But as I have repeatedly said in this place, putting money into children and services that support our children is the greatest investment that we can make as a country. And when budgets are tight, support for children and adolescent mental health should not be pushed aside. So as I say, I don't think it's an exaggeration to call the situation a public health emergency. And when it comes to a public health issue, we know that prevention and also early intervention are absolutely key. And that's where the role of schools, colleges and universities comes in. As we've heard, half of lifetime mental health conditions arise before the age of 14. So ensuring mental health support is available in schools from primary upwards is an absolutely critical intervention. The Liberal Democrats have long called for a mental health practitioner to be placed in every primary and in every secondary school. Given we know the impact of online harms on our children's mental health, we have strongly made the case for a polluter pays principle and that the big tech giants should bear the cost burden of this measure. A trebling of the digital services tax would fund a practitioner in every primary and secondary school in England. Now, I'm slightly confused, Madam Deputy Speaker, because I have heard the Minister when we've been discussing this issue during the Bill Committee of the Children's Wellbeing Bill, and I've seen in Labour Party materials that the government's committed to introducing specialist mental health support for children and young people in every school. But I know that previously they had a commitment for a counsellor in every school, and that was, at that point, secondary schools. And indeed, the Honourable Member for Redditch talked about a counsellor in every school. So I'm hoping that that point of policy will be clarified by the Minister when he speaks from the dispatch box in a moment. But during the Bill Committee, my impression was that it's the government's intention to actually build out from the mental health support teams that were established during by the last government. And he confirmed during the Bill Committee that only 44% of children and young people have access to these teams, and that will rise to 50% in April. But he did not set out a timeline or a plan as to how and when the government will seek to cover all schools to meet their commitment to ensure that every school will have access to specialist support. And the MHSTs are brilliant. I've spoken to staff who work in these teams, both in my own constituency and in Carshalton with my honourable friend, the member for Carshalton and Wallington. But the reality of the MHSTs is that they are spread far too thin across a number of primary and secondary schools, with some schools only getting half a day or a day's worth of support. I don't think this is enough, Madam Deputy Speaker. Last year, one teenager in a secondary school in my constituency took their own life. Another school in my constituency had 3 teenagers in the space of about 2 months end up in A&E, having attempted to take their own lives. Clearly, that level of mental ill health requires much more acute intervention than therapy in school. But the reality is that if we start early, if we start young with proper support, some of these truly awful incidents might have been prevented. And so the MHST model may well be the best model for support in schools, but I would urge the government to be ambitious in the resourcing of those teams so that every school has the full-time equivalent of one person in terms of the amount of support they have. I know many schools are trying to top up the resource out of their own funds, but with budgets being stretched ever further, sadly mental health support is one of the areas that head teachers and governors are telling me they're having to start cutting back on. And we know that the epidemic of mental ill health is driving the crisis that we've got in our schools of persistent absence. And as we've heard from the Honourable Member for, I think it was Honourable Member for Weston-super-Mare, we've heard a lot in recent days about the million or so young adults who are not in education, employment or training, often because of mental ill health. So for the sake of these young people's futures, for the sake of our economy and for our society, we must do better and we must do more. Madam Deputy Speaker, I don't have time today to talk about school staff, but again, this was mentioned by the Honourable Member for Weston-super-Mare. We know we've got recruitment and retention crisis in our schools, and that's because many teachers see themselves as the fourth emergency service, and we've got to support them with their mental health if we want to stop that flow out of our schools. On higher education, I hope the government will look at introducing a duty of care, because we've heard of too many tragic stories of students taking their own lives and their loved ones knowing nothing about their mental health problems. And I also want to pay tribute as well to a lot of the charities around the country that are really plugging the gaps that we've got in mental health support. In my own constituency, we have amazing charities like Purple Elephant and Off the Record, working with children and their families. Anstey Bridge works across Richmond and Kingston to step in to work with those children who are no longer engaging with school. And actually some of those are the suicidal ones who as I said before, there have been a number of attempted suicide cases in my constituency, and when I've been to Anstey Bridge, I've heard of many more stories of attempts of children taking their own lives, and these services are absolutely critical if we want to keep those young people safe and help them to recover. I just, before I sit down, because I know, Madam Deputy Speaker, you were... She's saying I've got a few more minutes, in which case I just want to touch on 2 more points. Childhood bereavement is a really important and often overlooked issue. I want to pay tribute to my honourable friend, the member for Edinburgh West, who has long championed the need for a register of those children who've been bereaved. We know that childhood bereavement has a terrible impact on children's well-being, potentially their mental health and their educational outcomes. I hope that ministers will look seriously at introducing a register so we know how many of these children there are, where they are based, and what support they need, because that information isn't available at the moment. And additionally, there's no national mandate from the Department for Education for schools to have a bereavement policy, nor is there any national policy to support schools with this. So I hope that will be addressed. And finally, the Honourable Member for Redditch mentioned children growing up in kinship care. The Minister will know that I have been long campaigning cross-party on support for kinship carers and children growing up in kinship care. I know that I and other honourable friends' inboxes have recently been filled with emails from constituents who have either adopted children or who are kinship carers for children whose parents can no longer look after them, and have benefited from the Adoption and Special Guardianship Support Fund. It's a really, really critical fund that that those parents and those carers are often accessing to be able to support those children who've suffered terrible trauma, often to support them with their mental ill health, and to provide therapeutic support for those children who've experienced trauma, loss and instability. Yet there are no guarantees, there's been no reassurance from government as to the future of that fund. If I'm correct, I think at the moment we've only got funding confirmed until the end of this month, and there's a huge amount of uncertainty, and honourable members from across the House have actually tabled written questions, and we keep there's been no clear answer on what the future of this fund is. So I hope that when the Minister gets to his feet at the dispatch box, he will put on record what the plans are for the Adoption and Special Guardianship Support Fund. It's crucial, and we cannot be losing it. So in conclusion, Madam Deputy Speaker, our children cannot thrive and they cannot achieve their full potential if they are not happy and if they are not well. So I implore the Minister to work closely with his counterparts in the Department of Health and Social Care to treat this public health challenge as an emergency. Our children and young people are only young once. They deserve the best future they can get. They cannot afford to wait. We need to prioritise this. Thank you.
I call the Opposition Minister, Dr. Caroline Johnson.
Thank you, Madam Deputy Speaker, and I'd like to congratulate the Honourable Member for Redditch on obtaining this important debate in the Chamber today. I'd also like to declare an interest because I'm a consultant paediatrician and I have worked throughout my career with children, usually at the point in of severe crisis when they've admitted through A&E to a hospital following episodes of having deliberately self-harmed, cutting themselves, taking overdoses and other such things. And I've seen quite clearly the heartbreak for families as they struggle to understand what it is they can do to best help their young person to get better. Over recent years, there's been a decline in the mental health and well-being of children and young people and an increase in demand for mental health services. And this is perhaps one of the big challenges of our era. Currently, around a fifth of children aged 8 to 16 are said to have a probable mental health disorder, up from 12.5% in 2017. And this figure is even higher at 22% for people aged 17 to 24. The consequences of mental health for students range from poor academic performance and dropping out of university or college to self-harm and suicide, and we must do all we can to help. And I wanted to briefly talk about university students because university is supposed to be among an enjoyable and formative period of your life. But for many people, it's also when they leave home for the first time, when they're separated for the first time from their family, their friends and their support networks. And data from the Office of National Statistics shows that during the COVID-19 pandemic, students reported higher levels of anxiety and lower levels of happiness than the general population. The number of students saying they have a mental health condition has increased 7-fold in the last decade. Even before the pandemic, students consistently reported worse mental health than the rest of the adult population, but these trends were greatly exacerbated by the impacts of lockdown. So can I ask the Minister, could he update the House on what steps he's taking to support young people with mental health problems as they go to university or that develop mental health problems at university? Despite the unprecedented challenges the previous government faced, not least a pandemic, we did make important strides in improving mental health services, in increasing the recognition and discussion of mental health problems, and increasing investment and reducing stigma. Between 2018-19 and 23-24, spending on mental health services increased by 4.7 billion, which gave an additional 345,000 young people access to mental health support they needed, and the number of mental health nurses increased by 30% since 2010. But still we see that demand is outstripping supply. Prevention is better than cure, and we do need to understand why we have such high levels of mental health problems in children. So can the Minister update the House on how the government's working to identify risk factors for poor mental health and how the government will support with children and support families to help prevent poor health? The last government, to try and detect mental health problems early and stop them from escalating, expanded mental health support teams in schools, committing almost £8 million of funding for 24 early support hubs in 24-25. These offered earlier, open access mental health intervention without the need for referral by a doctor or school. The drop-in centres offer vital advice to young people going through trauma of stress or anxiety, giving them a space to go when their problems first emerge. And I wonder what the government is doing in terms of expanding the availability of these centres and whether the Minister can update us on that. The Online Safety Act made very good progress in protecting children from harmful online content, but there is much more to do on the topic of screen time, as has been mentioned by honourable members this afternoon. Does the Minister agree with me that the mounting evidence we are hearing, particularly from health professionals, about the impact of smartphones in particular on children's mental health is very concerning? And if so, will he support the Conservatives' amendment to the Children's Wellbeing in School Bill to ban smartphone use in schools? However, there have been some concerns that the desire to support and enable individuals to have positive mental well-being, there is a danger that the pendulum has swung a little far and the boundaries between distress and disorder have become blurred. And the risk with that is it misses out, those who are most unwell may miss out on the treatment they deserve and need because of the volume of referrals, but it also risks burdening others with unhelpful labels and prescriptions that can hold them back without addressing the root cause of their very real needs. And 84% of GPs are now said to believe that society's approach to mental health has led to medicalising the normal ups and downs of life. The terms well-being, mental health and mental illness are often used interchangeably. So what steps is the Minister taking to distinguish between these terms in educational contexts and in other public services to ensure that we can get the best outcome for those affected and make sure that people get the treatment they clinically require? I want to pay tribute to the work that many charities do to support our young people with mental health problems, but also to ask the Minister to talk to his Chancellor about funding for these services, because Dr. Sarah Hughes, the Chief Executive of Mind, said that the implications of the NIC rise is, and I quote, eye-watering at a time when we're trying to direct every penny towards delivering the best support. These charities do immense work to create a mentally healthy society, putting everything they have into it, and this government should recognise this huge investment and not destabilise it by mounting costs that they simply cannot subsidise. It's also important to recognise there is a connection between physical and mental health, and that those with a long-term physical condition are considerably more likely to have poor mental health. So what is the government doing to support children who have chronic illness to help improve their mental health? In 2023, the now Education Secretary said that Labour want to train mental health counsellor available in every secondary school. What steps have they taken towards achieving this? And more specifically, why have they focused on secondary schools? In April 2024, Dr. Patrick Roates, the General Secretary of NASUWT, said, "We also need to see improved support for pupils in primary schools to secure wraparound care for pupils at all stages of their education." So what is the government doing to support children in primary schools with their mental health? Ahead of the last general election, the Labour Party promised to establish Young Futures hubs and recruit 8,500 mental health staff and provide mental health support in schools. Why has so little progress been made on delivering these promises? When the Government Minister stood on a manifesto to establish the Young Futures hubs, it was said to have a £95 million cost, and they provide mental health support in all schools, a £175 million cost. They said they would fund it through revenue from applying VAT and business rates to private schools. Can the Minister confirm if the revenue obtained from applying the VAT to private schools looks like it will be sufficient to expand the mental health support as described? And if not, how does the Government intend to fund these measures that they said they're going to do? In a speech to the Confederation of School Trusts on the 7th of November last year, the Education Secretary also claimed that the Government would give every single child the very best chance in life in a new era of child-centred government. So how does she justify the impact of well-being of those children who are forced to move schools due to the imposition of VAT on the private sector? Numerous think tanks and mental health charities have noticed that being forced to move school at a non-standard time has had a significant and long-lasting impact on children's friendships, support networks and emotional development. What support is the Minister offering those children? In conclusion, Madam Deputy Speaker, mental health issues among our young people are one of the defining issues of our time. As with so many other policy areas, the Government has promised a panacea, but it has delivered so far a sticking plaster.
I now call the Minister, Stephen Morgan.
Thank you, Madam Deputy Speaker, and I'm grateful to my honourable friend, the member for Redditch, for securing a debate on such an important subject, which rightly invites considerable cross-party support. We know that 1/3 of adult mental ill health originates before age 14, and 6 in 10 have their first onset by age 25, meaning that childhood and early adulthood is a critical period for early interventions and prevention. That is why this government has set a bold and new ambition to raise the healthiest generation of children in our history, which of course includes their mental health and well-being. Madam Deputy Speaker, we have seen increases in mental health issues in children. NHS surveys suggest that around 20% of 8 to 16-year-olds had a probable mental health disorder in 2023, up from 13% in 2017. Well-being or life satisfaction of children and young people also shows cause for concern. Long-term reductions in children and young people's well-being are a common trend across countries, and we have to acknowledge that England and the UK report among the lowest levels of average life satisfaction among participating countries. There is no one simple reason for this, and rising mental health challenges is an international phenomenon. The ongoing impacts of COVID-19, such as school closures and reduced opportunities for social and emotional development, are a factor, as are changes in health behaviours like low physical activity, increased eating and sleeping problems, and increased screen time and social media use, points made by a number of members this afternoon. Now, there are also a wider range of contributing societal factors and ongoing national and global issues like economic outlook, international conflict, and climate change. Now, the relative influence of these different drivers is complex, and taken together, they show the scale of the challenge that we are facing.
Will the Minister give way?
I will give way.
I thank the Minister for giving way. Amongst children and young people who suffer the most acute mental health challenges are looked after children and young people, all of whom will have experienced some kind of adverse childhood experience or trauma resulting in them being taken into the care system. My committee heard evidence a couple of weeks ago from children and young people who talked about the lack of adequate assessment of their mental health when they are taken into care and when they move placements. And they are calling for a strengthening of the regulations around that so that their mental health and well-being is properly taken into account. I've tabled an amendment to the Children's Wellbeing Bill, which we'll be discussing early next week. I just wonder if the Minister could give a commitment to look at that and to see whether we can get the support to be better for children who are looked after. Minister.
I thank my honourable friend for her intervention, and I know that she's a real champion for looked after children. We will certainly look at those proposals and indeed look at all work that the Select Committee does to support our most vulnerable children in society. Madam Deputy Speaker, prevention is vital, and schools and colleges can naturally play a preventative role through what they do day to day. Attainment is a vital factor in longer term mental health, helping young people have access to the things that they want to do in life in further study and jobs. Madam Deputy Speaker, the best schools and colleges set high standards and high expectations and support children to overcome barriers to their learning, including those with special educational needs and disabilities. They also understand that a child's experience at school helps them to both achieve and thrive. Education settings also support the social and emotional development of their pupils through what is taught in lessons, through extracurricular activity and through pastoral support. Pupils who are thriving with positive subjective well-being and a strong sense of belonging, accomplishment, autonomy and good health achieve better educational outcomes and are more likely to attend school. They are better equipped to face issues in their lives, which is important. Now, not every child facing mental health issues will need clinical interventions. The support that they get from their friends, families and school or college staff can be what they need. Like my honourable friend for Weston-super-Mare said, I'd like to acknowledge and recognise the many thousands of school leaders, teachers and staff committed to promoting and supporting the mental health and well-being of their pupils every day through the things that they do to make school a safe, supportive and inclusive place for children, supporting specific needs of children and working with parents and families and other community services. Madam Deputy Speaker, we know that as many as 9 in 10 schools have a designated lead for students' mental health and that over 3/4 have benefited from DFE-funded training, helping leaders embed effective whole school or college approaches to mental health and well-being. Nevertheless, schools and colleges themselves need support with what to do and cannot deal with every issue that pupils have. That is why, as a government, we have committed to provide access to specialist mental health professionals in every school, so every young person has access to early support to address problems before they escalate. This commitment will be delivered through the expansion of NHS-funded mental health support teams. These teams will work in schools and colleges, offering early support through evidence-based one-to-one and group interventions, liaising with specialist services and supporting leads to develop their holistic approach to mental health and well-being. These functions, supervised by a clinical professional, are what makes mental health support teams such a valuable resource. And I've seen this important work firsthand on visits to education settings in Brighton, to Manchester and Rugby. Madam Deputy Speaker, by April 2025, we expect these teams to cover over 50% of children and young people in schools and colleges, and plans for further expansion are being drawn up with the NHS to achieve 100% coverage as soon as practically possible. I will give way.
Munira.
I'm very grateful to the Minister for giving way. Could he just clarify for the benefit of the House, if that's access to specialist mental health support, what sort of level of resource does he expect that to be? Might it be half a day a week, a day a week, or is that full-time equivalent? Because I know the previous commitment had been to a counsellor in every school. Thank you.
Minister.
I thank the Lib Dem spokesperson for that intervention. I can assure the honourable member that there will be access to mental health profession in every school, and we are working at the detail of that as we speak, and will announce more in due course. I will make some progress, if I may. The pace of the rollout of mental health support teams will be determined by local needs and presents a substantial investment in the workforce growth and training through this Parliament, and further announcements will be made in spring. I'm going to carry on. We recognise that our pledge for every school to have access to specialist mental health professionals is not the whole answer. Schools are facing their own pressures and rely on health professionals for diagnoses and treatment for their pupils' mental health needs. Now, we all know from our own postbags and inboxes, and as my honourable friend for Redditch shared during his contribution, that waiting lists for those referred for specialist support are too high. The Department for Health and Social Care is working to bring waiting times down and intervene earlier. In addition, government will be putting in place the new Young Futures hubs, including access to mental health support workers, and will recruit 8,500 new mental health staff to treat children and adults. As well as targeted mental health support, we must also tackle the wider drivers affecting children and young people's mental health. For instance, my department's comprehensive child poverty strategy will be central in unlocking opportunity and giving every child the best start in life. In addition, we recognise the importance of monitoring and understanding trends in the well-being of children and young people, and already closely monitoring national data and research on children and young people's mental health and well-being, and encouraging schools to measure pupils' well-being. Madam Deputy Speaker, since becoming the Minister for Early Education, I have seen and heard about such incredible work going on in schools and colleges across the country, listened to the issues education staff continue to have, and it brings real joy to engage directly with children and young people across the country. My department will continue to support education staff and provide a range of guidance and practical resources to help schools to embed effective whole school or college approaches to mental health and well-being. For example, a resources hub for mental health leads and a toolkit to help choose evidence-based early support for pupils. And I recognise that there is interest across the House in a number of different forms of support, such as counselling provision, as we've heard this afternoon. We believe that schools are best placed to choose what provision best meets the needs of their pupils, but ensure that there are resources in place to help schools do this well. I will give way.
Charles Berry. Thank you very much. Would the Minister agree that what has been announced today does fall short, that access, presumably by appointment, to services that are available in a local area, presumably in a different setting, is not the same kind of availability to support as having counsellors, properly qualified counsellors, in schools?
I can assure the honourable member that I haven't announced anything today, and as I mentioned in response to the earlier intervention, we are working through the detail of this, but the commitment is access to dedicated mental health support in every school, and it was a real pleasure to visit her constituency and see that work first-hand. Now, a number of members are interested in the role of councils in this important issue, and turning to public health, local government's public health responsibilities are an essential element of preventing ill health, promoting healthier lives and addressing health inequalities. The Department for Health and Social Care will provide more than £4 billion of public health funding in 2025-26, including over £3.8 billion in the public health grant to local authorities, which is an average of 5.4% cash increase, or 3.0% real terms increase in the local authority public health grant funding compared to the last financial year. And this represents a significant turning point for local public health services, marking the biggest real terms increase after nearly a decade of reduced funding. Madam Deputy Speaker, I want to thank all members across the House for their contributions this afternoon. My honourable friend for Redditch spoke with real insight and passion about the support needed to support children and young people, the need for parity between physical and mental health, and made a number of informed contributions based on evidence and research. May I also pay tribute to my honourable friend for Blaydon and Concert, who I know for some time has spoken in this place on behalf of families who have lost loved ones due to suicide, and for working alongside the hugely dedicated campaigners that are Three Dads Walking. I've had the privilege of meeting those individuals, and frankly they are inspiring in the work that they do. We heard from the chair of the Select Committee, who made a number of points from her experience on the Select Committee and from visits to her own schools, and I look forward to her continued constructive engagement as we progress our ambitions on mental health in this place. A number of members made contributions on support for SEND children, and I'd like to say that every child, regardless of their individual needs, deserves the opportunity to achieve and thrive and succeed. And this government is aware of the scale of the challenges in the current system, and we have made clear our commitment to addressing these. In conclusion, Madam Deputy Speaker, I'd like to assure my honourable friend, the member for Redditch, and all members that this government prioritises the health and happiness of children and well-being. We recognise the need for further support in schools so that all children can achieve and thrive, including tackling this generational challenge of school absence and bolstering young people's well-being and sense of belonging. We value the many contributions from across the House in the debate today, and I again thank my honourable friend for Redditch for securing this debate.
The last few minutes go to Bloore to wind up.
Thank you, Madam Deputy Speaker. And first of all, let me thank the Minister for his comprehensive response, but also the way in which his department has helpfully answered as many questions that my office has put through to him. I would also like to say I thank him for some of his candidness at the dispatch box, and I look forward to a lot of the detail following from some of the questions from honourable members from all sides. I'm going to do a quick speed dating reference to a lot of the comments that people have made. I'd just like to thank the member for Dulwich and West Norwood for her expertise and comments, particularly on SEND provision. I'd like to thank the member for Brighton Pavilion for raising awareness of the success that her and campaigners have had in her constituency. The member for Horsham, as a former county councillor, I understand the challenges that county councils, particularly in rural areas, are facing, and I understand his frustration. I thank the member for Ashford for his focus on early intervention, and support his viewpoint that cross-government departmental working is vital to make progress on this issue. I'd like to thank the member for Stafford for her intervention, and how sad I am to hear about students being told to unroll from school because provision is not available. That's simply not acceptable. I'd like to thank the member for Weston-super-Mare for his excellent and heartfelt comments about representing his residents, but also for his timely comments about the work of teachers in our schools. I'd like to thank the front bench spokesperson for the Dems, the members for Twickenham. She has a long history on this subject. I've read many of her contributions over the last 2 weeks, and I know she is fully committed to this cause. I'd like to thank the Conservative member for, is it Sleaford and North Hykeham? I apologise, for her thoughtful comments, and obviously for her expertise in the area that she works in prior to this place. And finally, I would just like to say, we're talking about the life chances of our children in this debate today. We've made so much progress on bringing discussions about mental health to the forefront, and we know the difference that early intervention can make. It's okay not to be okay. We've made progress on people feeling that they can say that, but it won't be okay if we don't make the progress to support children in the long run by the time this Parliament's over. Thank you.
The question is, as on the order paper, as many of that opinion say aye? Aye. Contrary, no. The ayes have it. The ayes have it. I'll allow the front bench a moment to swap over.